What information does 42 CFR Part 2 protect? Have you ever wondered how your privacy is protected when seeking help for substance use disorders? Understanding the specifics of 42 Code of Federal Regulations Part 2 can help clarify this important issue. So, what exactly does this regulation protect? First and foremost, 42 CFR Part 2 safeguards the confidentiality of records related to the diagnosis, treatment, or referral for treatment of individuals with substance use disorders. This means that any information that identifies someone as having or having had a substance use disorder is protected. This includes treatment records, referrals, and any clinical documentation held by programs that receive federal assistance. The regulation was created to prevent negative consequences for individuals seeking treatment. This includes avoiding discrimination or legal issues in areas like employment or family matters. It ensures that information about substance use treatment is not disclosed without the explicit written consent of the patient. There are very limited exceptions, such as in medical emergencies or specific legal situations. One key aspect of 42 CFR Part 2 is the requirement for consent. If a healthcare provider wants to share any information related to substance use disorders, they must obtain a written consent form from the patient. This form must specify who can disclose the information, to whom it can be disclosed, and for what purpose. In comparison to the Health Insurance Portability and Accountability Act, or HIPAA, 42 CFR Part 2 has stricter rules. While HIPAA protects general health information, 42 CFR Part 2 imposes more stringent restrictions on substance use disorder records. This means that even for healthcare operations or payment purposes, disclosures usually requiring patient consent. There are also limited exceptions where information can be shared without consent. These include narrowly defined situations like medical emergencies or when sharing with qualified service organizations that have agreements to protect the information. Another important element is the protection against redisclosure. If an entity receives information protected under 42 CFR Part 2, they must follow the same confidentiality rules. They cannot share that information outside of the permitted uses without the patient's consent. In practical terms, 42 CFR Part 2 allows individuals seeking addiction treatment to do so with the assurance that their sensitive information will remain confidential. This helps reduce stigma and the potential for negative repercussions. For addiction treatment providers, understanding these protections is essential for maintaining patient trust and complying with federal confidentiality laws. Coordination of care involving substance use disorder information requires careful handling and explicit patient authorization to share records beyond the treatment setting.